I want to welcome you to the August Disaster Information Specialization meeting. My name is Siobhan Champ-Blackwell, and I'm here with staff from the National Library of Medicine Disaster Information Management Research Center. And before I turn you over to our special guest speaker, Nicole Strayhorn, I wanted to remind you that we have updated our website and hope that you have taken a look at it since our last meeting. This is what it looks like. I wanted to show you a feature that we had on our old website that we brought over just to make sure that everybody is still making use of these great tools that we have. We know that there are a lot of incidents going on around the country and around the world right now. We're all of us worried about the fires and wildfires, of course, in California. And one of the things that we provide through our health information guides that we do on the natural and man-made disasters, as well as the infectious diseases and some of our special topics as well, is provide this syndication. So on the pages that we offer this, which includes, besides wildfires, the floods page, information guide, the hurricane, earthquakes, information guide, we provide it for virtual reality training and others, is this ability to embed our website in yours. So we have set up an account with the Health and Human Services syndication storefront, and if you go, for example, from this page, you can directly get to the HHS storefront where you can, in a sense, buy this. It's free, of course, the code. You log in. If you haven't got a login, you can register for one. It's free. And when you log into this storefront, what you will see down here where it says embed code snippet, it will provide you with the snippet. And that snippet allows you to embed this page at the bottom of your fires and wildfires page. And our page, we keep constantly updated. We have some resources that are basic, important agencies, key agencies. And then we keep our pages current because we've done some pre-formulated searches on our disaster lit gray literature database and on PubMed. So, for example, you can see here under the general health related information, you can see the latest 2 documents that have been added to Disaster Lit on that topic. If you want to see more, you click on the more, and you can see the search that was done to bring up those 2 items that showed up on the page, but there's a pre-formulated search. So this page constantly stays current with the latest gray literature that has been added within these topic areas. Smoke inhalation is definitely a problem right now out in California. We also have pre-formulated searches for PubMed. So if I click on more, I've got a search on PubMed that will that has come up. And if I go to the advanced search, I can see some of the searches that I've done in the past and what those searches look like. And you can see that PubMed can be a tricky thing to search. So the fact that we've got librarians who have played around with the mesh terms and the different fields, it's a very useful tool for you if you want to stay current in what's going on in wildfires and health. So all of our health information guides are outlined that way, and several of them have this syndicated storefront. So I hope that you take a look at those and find them useful to have added to your page. Also, if you want the MLA, the Medical Library Association continuing education, we offer 1 continuing education credit for this. And Jen, I don't know if I sent you the link for the survey that you can fill out. If you can put that in the chat box. And then also I'm going to put, when I'm done talking, which is in about 2 minutes, I'm going to put in my email address in the chat box, because there is also, MLA has created a new process for handing out certificates, and so you have to get the certificate itself, you have to have an MLA login, which also is free, and I'll give you the code and information on how to do that, and you can email me and I'll send you that information after the call. So we will be putting this webinar, we're recording it, we're going to put the recording and the slides from Nicole's presentation on our website. It takes a week or two to get everything up to speed on to get it onto our website, so give us a few minutes to do that. So I am going to stop sharing my screen, and I'm going to very happily turn the call over to our associate, the National Library of Medicine Associate Nicole Strayhorn, who has spent this spring semester doing a preliminary study for us on open data in disasters and public health emergencies, and coming up with some key resources for us and some future steps that we might take. So we hope that you enjoy her presentation on this, and Stacy will, after we have time to have questions with Nicole, Stacy Arneson, our branch chief, will talk to you a little bit more about some of our future directions in this area. So go ahead, Nicole. Thank you so much.
Thank you, Siobhan. Good afternoon, everyone. Before I get started, I wanted to introduce myself a little bit more. I'm originally from Atlanta, Georgia, and I graduated last year with my master's in information from Florida State University. I also have quite a few years of experience working in various different libraries, and I also have various interests, including food deserts, women's health issues, obviously disaster information, and data visualization. So with that, I present to you Battling Zika with Open Data. So first, I would like to start off by discussing open data as it relates to disasters and public health emergencies. Then get into my case study of open data and Zika. And next, I will talk about my process throughout this project, then present my results, and finally discuss what the future may hold for this research. So what is open data? Well, according to the Open Knowledge International Organization, open data is data that can be freely used, reused, and redistributed by anyone. However, open data is not necessarily publicly available data. Open data means that whatever data is released is done so in a specific way to allow the public to access it without having to pay fees or be unfairly restricted in its use. But why is open data important for disasters and public health emergencies? For one reason, open data is used to gain situational awareness. In this context, situational awareness is thinking about the hazards and their consequences associated with disasters or public health emergencies. This helps emergency professionals and public health professionals improve planning and response. This image is an example of a federal tool adopted by the Office of the Assistant Secretary for Preparedness and Response, or ASPR, that analyzes Twitter data to identify trending health topics that may serve as an indicator for potential public health emergencies. Another reason open data is important is that data can help communities prepare for and respond to disasters and public health emergencies. This image is an example from RX Open, which is a mapping application that allows users to identify open pharmacies during times of disasters. They also include open Red Cross shelters when active. This is created by and developed by Healthcare Ready, who collects their data from pharmacy switches and clearinghouses, who provide a daily list of all pharmacies that have billed for prescription within the past 12 hours. They also merge data from the National Council for Prescription Drug Programs. I've actually remembered this tool from being shared during the Hurricane Maria response on Twitter and Facebook. I even shared it myself as I lived in Florida during that time. It's now actually currently active for the wildfires in California. And the data actually that's displayed can actually be downloaded in Excel format. And then finally, open data can be used to track the spread of diseases. This is an example from Health Map, which is a tool that utilizes disparate data to monitor disease outbreaks and provide real-time surveillance of emerging public health threats. The data is collected from freely available sources, including the World Health Organization, Eurosurveillance, and the Food and Agriculture Organization of the United Nations, just to name a few. The image is actually displaying locations of alerts from the Ebola outbreak from 2012. But where is this data that these tools are using? Where does it come from? But as we all know, there are various types of disasters and public health emergencies. But they are managed and mitigated differently, which means you need different types of data to respond to those events. So for this project, I actually selected the Zika virus outbreak to identify different sources of open data. But to start off, I wanted to discuss the timeline of the Zika virus outbreak. And so as some of you may know, the Zika virus is a mosquito-borne virus that was originally discovered in Uganda in 1947. It can be transmitted through not only mosquito bites, but also from pregnant women to their fetus, through sex, and also through blood transfusion. But fast forward to 2015, Zika surfaced in Brazil, but quickly spread throughout the Americas. But there was also a sudden rise in microcephaly among newborn babies, which causes the head to form small. And there was also a rise of the Guillain-Barré syndrome among adults, which is a neurological disorder. And so on February 1st, 2016, the Zika virus outbreak was declared a public health emergency of international concern by the World Health Organization. And this is actually a map of all of the areas where there was a risk of Zika infection as of March 2018, according to the CDC. But getting back to the topic, where is the open data that was utilized to help respond to the Zika virus outbreak? We must first understand what kind of data was needed by the public health professionals and emergency personnel. So some of the examples that I came up with were obviously patient demographics and where were those patients located. And then obviously the number of confirmed and suspect Zika cases, how is the virus being transmitted, the different modes of transmission, understanding the symptoms, results from any testing, mosquito surveillance, climate and weather data, and then also information on vaccine development. So here were some of the questions that came about early on in this project before I really dive deep into locating data sources. One being, who is involved in this kind of research? What organizations? The World Health Organization, the CDC, you name it, we were thinking about it. And then the next question, what are the data needs of stakeholders and organizations working on these public health emergencies? And where do they deposit their data? And what are the sources of that open data? And how was the data being used afterwards? And then next, what are the barriers to discovering and accessing data for disasters and public health emergencies? And what are the efforts already underway for data sharing and open data in public health emergencies? So next I want to discuss the process for this project. The first step was really trying to get familiar with the subject area, open data, and also Zika, how it relates together. So I did a preliminary literature search and PubMed, DisasterLit, and Google to help me find more information about the subject. And then throughout this search, I actually found a statement that was made by the Wellcome Trust along with other individuals or organizations on data sharing, Zika, and the future of public health emergencies. So within this statement, there were actually 30 funders and publishers that signed the statement to show commitment to data sharing, especially for the Zika virus outbreak. But I used this list actually of the funders and publishers to identify data sharing policies to help me get more familiar with open data and how it relates to Zika. But almost in every data sharing policy, I noticed that there was a recommended or suggested list of data repositories that could give you access to open data. So I selected at least 5 of those suggested data repositories for this analysis, but also found other repositories outside of the selection through random Google searches. But within each data repository that I selected, I searched for Zika to see what kind of open data was available for users. So this is the sample of the Wellcome Trust statement of all of the 30 funders and publishers that agreed to open their data to researchers during outbreaks or public health emergencies. So this is a sample of those 30 publishers and funders, just to give you an idea of the suggested repositories that I mentioned earlier. A lot of them had common suggested repositories, including Figshare, the Harvard Dataverse Network, Zenodo. But then in particular for NIH, since I am an Associate Fellow, they offered 73 different repositories to share your data. So next I would like to discuss the open data sources that I actually looked further into as I was doing my research. So the first one is the CDC Zika data repository that they created on GitHub actually, which I was actually surprised myself. But they offer access to data sets of confirmed cases of microcephaly, cases of Zika, and different reports created by the CDC. And the first version was created back in February 29th, 2016. And they offer the data to be downloadable as CSV files and PDF, depending on what you're looking for. And then the next one is the Zika Open Research Portal, which was actually created by a professor and other collaborators from the University of Wisconsin who wanted to make Zika data openly available for researchers during that time. And so again, they offer different types of data, clinical data and genomic data, and also summary results. And they offer it in multiple ways to be downloaded, Excel files, text files, Java, PDF, and R and Python scripts. And then the next one I found was Zika cumulative cases. And I found this listing of Excel files on the Pan American Health Organization, and it's an aggregation of all their summary results about their cases, Zika cases, and they make this freely available on their website. And then finally, a lot of the articles that I did during my literature search, my preliminary literature search in PubMed, I noticed that a lot of articles related to Zika actually deposit their data in Figshare. A lot of them were actually published through PLOS, but then they share their data through Figshare. And I looked more into this, and I actually found out that Figshare and PLOS have partnered together to ensure that there was more access to open data during the Zika virus outbreak. So again, in Figshare, a lot of data is related to surveillance data, genomic data, and different case data. So next, I want to discuss about how Zika has been used, or Zika open data has been used in various ways. The first example being Zika data has been used in the NextStrand platform, which is a visualization application that integrates genomic data with other data like geographic locations to show the evolution and the spread of an outbreak. They utilize open data from NCBI's GenBank, Viper, and a few GitHub repositories. And as you can see, this is showing the evolution of the Zika virus outbreak. And if you're actually on the website, you can interact with it and gain access to the actual data sets. My final example is another application of how Zika virus data has been used. And this example is called Zika modeling, which was created through a collaboration of Northeastern University. And this model integrates a plethora of data sets, including demographics, transportation, socioeconomic, temperature, vector, and of course, Zika and microcephaly data as well. And if you're on the website, you can interact with the map to get different scenarios that they were obviously modeling through all these different data sets to see perhaps project when the Zika virus was spread in different areas. So with that, future research. So I gave you a lot of examples of where you can collect or extract open data from different sources, from GitHub, from international organizations, or federal organizations. But we do need to take another step further in this research. And perhaps we need to look at the first one, data quality. As I was looking at different data sets that was open, I noticed that a lot of the data is kind of messy and not necessarily understandable for everyone to use. So I think this is an important area to look at. And then the next one is preservation of that data. Some areas like GitHub were not necessarily maintained. Some of those repositories weren't maintained, and they had a lot of broken links. So you really couldn't access the specific data sets that you need once you got to that link. And then next, perhaps we can explore the new data filters that became available in PubMed back in earlier this year in April. They offered 3 new ways to explore or find data through PubMed. And then next, another research avenue we could go through is interviewing researchers and understanding how they decide where to place their data sets. The next one, identifying challenges in collecting data during disasters and public health emergencies. We can gain a better understanding of the boots on the ground people that are collecting that data set first, and then how they distribute it. And then finally, looking at non-traditional data that is being collected, social media and reports. As I showed you earlier, there was a federal tool that uses Twitter data to help them, kind of plan for a response. So I think these are the next steps that we could possibly take in this type of research. So with that, I'd like to acknowledge Siobhan, who is my project sponsor, and then Stacy and Colette, who helped me throughout this project, and also Alicia from the NIH Library, who also helped me with my research as well.
Wow, thank you so much. Whew. that was a lot of work, Nicole. And at DMRIC, we're really happy to have had these first steps started for us, and the work that you've done in organizing the repositories. For one thing, we have a question that showed up in the chat box asking if we have a list of these open source repositories, and because we'll have the PowerPoint slides on our website, that's our first step to having anything like that on the DMRIC website. So if you have any other questions, go ahead. And then Stacy, you were going to do a little bit more discussion on this future research area.
Sure. Thanks, Siobhan, and thank you so much, Nicole, for your presentation and doing this first line of work on taking on this rather difficult task. It seems like it should be easier than it is, and we can find many challenges. In looking at some of the future research and areas that NLM hopes to be able to explore a little bit more, and hopefully with other organizations and agencies, and we know that some others are also doing some of this work together, so I hope we can integrate our efforts across the government and as well with other partners as well. I do want to just emphasize what Nicole said about the data filters in PubMed and PubMed Central. I think many of you, just to refresh people's memory, PubMed is the bibliographic database providing the references to the journal literature, and then PubMed Central is a repository of free full-text articles. And so they do have these new data filters that allow you to look at whether there's a data availability statement included in there and may link out to the original data. Ones that might have other supplementary material, might not be the raw data, but it might be other material that didn't actually make it into the article, but that you might like to see. So you might want to take a look at that. Just as a quick glance, looking in PubMed with the data filter, there are about 39 references on Zika that have the data filter or the data tag on it, so they have some data included in those articles, and this is from about 5,000 references that are now about Zika that are now indexed in PubMed. So a small number, but growing, and I'm sure that will change over time as there's more effort to include data into research articles. So we know that there are many challenges to collecting data during disasters and public health emergencies. In some cases, it might be difficult to quickly get researchers to the affected area. In some cases, you're so busy with the response and recovery that it's hard to actually collect data at the same time. And NIH and others, ASPR was one that the Assistant Secretary for Preparedness and Response, and the CDC and others are also working on these issues. And several years ago, there was an editorial that was written by Dr. Nicole Lurie, who at the time was the Assistant Secretary for Preparedness and Response at HHS, Dr. Frieden, who at the time was the CDC Director, and Dr. Collins, the NIH Director, calling for the need to improve research in times of disaster and public health emergencies. So based on that, NIH, starting with NIEHS, the National Institute for Environmental Health Sciences, and the National Library of Medicine, began a disaster research response program, also known as DR2, and you can check out the website at dr2.nlm.nih.gov. And there were several focus areas for this program. The first was looking at, well, what kind of data collection tools are already out there and have already been used. And so we developed a small database of tools that have been used in previous disasters. And the idea here was so that people would have something quick to get to and wouldn't spend the time recreating the wheel, so to speak, and creating new data collection tools, new questionnaires, etc. We know that happens quite often, having read grant proposals of, we'll develop a questionnaire on X, instead of looking to see if something has already been developed and already been used. Having new data collection tools for each disaster, for each community, makes it difficult to do comparisons within a disaster in different communities or across disasters. So we wanted to try to get people to use similar tools. Along that same line, we're working with another NLM program, the Common Data Element Repository, which is a collection of data collection tools as well as a database of every question identified in those data collection tools, and also has an ability for you to build your own questionnaire from the existing tools and the existing questions. So again, trying to see what has been done and not starting over again. In addition, for this DR2 program, they developed a research protocol to collect data as quickly as possible after disasters. This includes questionnaire as well as the collection of biological samples with instructions on how to collect those biological samples, the blood, urine, hair and nail samples, those kinds of things. And specifically, this protocol has received pre-review by the NIEHS IRB. So even without a particular instance in which it will be used, it has been pre-reviewed by the IRB so that when a situation arises and they want to use it, the IRB can quickly look over it and give their approval because they have seen it already. And we work very closely with the NIEHS IRB to work on this pre-review so that to help with this issue of trying to collect information more quickly after disasters. And this really focused this first protocol on workers who would be going into perhaps doing cleanup, whether it's an oil spill, whether it's after a hurricane with mold, etc., so that we'd have baseline data and then interim data on these workers. And now they're also working on a protocol for community members as well. And then the third area was to conduct training and exercises in communities to demonstrate the value and need for quickly collecting data and how researchers can work within the response to recovery frameworks and not get in the way. But so they understand why you want to collect this data, the importance of it, and also to be able to work within the framework easily and understand the conditions in which they're working. And we've made some strides in this area. Typically, it's been taken 9 months to get funds out the door and grants awarded to collect data after disasters, which of course meant you've missed quite a lot of data, baseline and interim data. And after Harvey, they were able to start collecting data much more quickly, partly because exercises conducted in Texas previously, and Texas developing their own protocol and getting their own IRB approval ahead of time, they were able to partner with others and start collecting data very quickly. We know that NIH is not the only group working in this area in disaster research response. We are also working with other agencies, ASPR, CDC, USGS, Department of Interior, and National Science Foundation and others, together with the National Academies of Science, Engineering, and Medicine to further pursue the development of a disaster research framework. I also want to mention that, as Nicole had talked about, the non-traditional data, there's many forms of non-traditional data. Some of it could be things like reports, training materials, other kinds of websites, guidelines, etc. And just to remind folks that we do collect this information in our disaster lit database. So some people think of gray literature as not, it's not really peer-reviewed, it's not high quality, but what we're looking at here is taking information from selected resources. Siobhan, what are we up to? Over 800 resources, 800 sources now? Quite a few, but we have selection criteria. So these include government agencies, these include a lot of NGOs, such as Healthcare Ready, which we talked about in terms of the open data on pharmacies, Red Cross, World Health Organization, Pan American Health Organization, Doctors Without Borders, other organizations who work in this area who don't necessarily have the time or need to publish the work that they do in peer-reviewed journals. But they put out quite a lot of information. So, for example, the Ebola outbreaks, I think CDC issued over 100 guidelines, and those guidelines were not in PubMed because they were just on their website. So we have that complete index to those guidelines in DisasterLit with an easy way to identify them. So I just want to remind folks that that information, which actually often comes out much faster in a disaster or public health emergency than items that go into PubMed, so you may want to take a look at disasterlit.nlm.nih.gov. Other forms of non-traditional data come in the forms of a lot of the social media that's being collected, or data that might be collected through crowdsourcing or citizen science efforts. So we will continue to explore what the Harvard Humanitarian Initiative called data preparedness, which is the ability of organizations to be ready to responsibly and effectively deploy and manage data collection and analysis tools, techniques, and strategies in a specific operational context before disaster strikes. You have to have this, as many of us know in the disaster field, you have to be prepared in order to be able to respond well. So having these tools and techniques ready to go ahead of time so that they can be used in the response. So we're taking a look at and how we can fit that in through our different resources that we have and how we might be able to play a role in that area. And the other area looking at is how all of this data that's coming out can be made available, continue to be made available in a timely fashion. Nicole also talked about how there are a lot of broken links now, things aren't being kept up to date, but how that information can be preserved, and then how this data can be used for discovery. That there might be ways that they haven't thought of at the time that it was immediately collected, but over time, as other data is collected and made available, information from other sources, other types of information, how can data science be applied to this information and perhaps lead to discoveries that may aid in treatment, may aid in vaccine development, may aid in prevention. So those are all areas that we want to think about. And know that it's vital to have librarians and information specialists who are helping with this sort of fire hose of information that's out there and selecting the relevant, timely, and evidence-based items so that others can use this information in effective ways and not have to sort of minimize the amount of information that they have to sift through and get to the information that they need quickly and easily. So those are just a few areas that I wanted to mention about that we would like to pursue. We would certainly like to continue looking at the area of open data in terms of, well, in any area of biomedicine, but particularly in public health emergencies where time is of the essence and where data is coming in from so many different sources and there's so many different kinds of data, as Nicole also mentioned, how this information can be made available to any and all of those who need that information to aid in the response and recovery efforts. So thank you very much, and we're open for questions.
So this is a lot of information that we have presented today. And again, we're going to put the webinar recording and the slides on our website, because I think that there is a lot of information to look at and a lot of links that might be of interest to people. So we'll also pull out a list of the links and have maybe a Word document that includes the links that were put into the chat box during this session, so you don't have to go searching around for them either. And yep, type the questions into the chat box. The chat box is up on the top right-hand side of the viewing box that you have. So hopefully you've all seen that chat box before it's a little bit late to be looking at it now when we've put all the links in. Sorry, I should have mentioned that at the start. And I don't see any questions showing up. I will once again put my email address into the chat box, and if there are any ideas that you have or questions that you want to follow up on, this is a new area that we are exploring. It's not a new area. It's an area that we're exploring, that we've done work in, that we want to do more work in. I'm also going to put one of our classes that we have created is the social media analysis course, which that's another type of data that is invaluable during disasters. So we have a Medical Library Association course on social media analysis, if you're interested. So Anne, if you want to email me, I will send you, there's first of all a survey that you have to fill out, which I'm going to put in the chat box. But then the Medical Library Association has, you have to log into their learning management system and then put in a code. And I will send you the link to their learning management system and what the code is. So just go ahead and email me.
The question did come in, Siobhan. And if you could scroll up to see the question again in the chat. So it was asking if, does DMRIC provide data analysis support, such as data analysis code, crosswalks between data sources, etc.? I have to say, unfortunately, no, we do not. That would be really great if we could, and we would, and maybe in the future that is something we will do, but no, we do not at this time, I'm sorry to say.
Are we planning to, Stacey?
Well, not at this time. At this time, we don't have the resources to do that, although it's certainly an interesting area that we would love to explore, but at this time, we don't have the resources to do that.
Okay, and seeing no other questions, I think we can go ahead and close out the meeting, and feel free to contact any of us at DMRIC with any questions or follow-up that you might have. And we appreciate your attending this webinar. Thanks so much, and have a great day.